this has been a very rich experience for me, especially learning with community engagement that I had not done to that extent before. I had worked specifically mostly in the facilities, but when I got to know what we say as health workers and the perspective of the community, it really opened my other perspective to relook at what we are doing as a ministry in MIYCN. I'm learning a new aspect of the importance of having evidence for the programs we are doing we are putting in place as from the Ministry of Health, because I find that I get to go deeper and love research, and even now I'm starting to write scientific papers in regard to research which I had not thought so much about before. It was a very rich experience. They are advanced in terms of implementation of baby-friendly community initiative. We had quite numerous visits to provinces which were quite far, and we had interaction with the mothers, the baby-friendly community initiative groups, which they call mother support groups, where we have various members like the chiefs. The fact that they do campaigns, we met mothers, they showed us how they normally conduct campaigns for infant feeding, especially breastfeeding, and they have taken complementary feeding very seriously. Influenced my work is that immediately I came from Cambodia. I shared the experience with the larger stakeholders meeting, and they were actually happy, especially the way they conducted the mother support group and the way the community has owned the programs in terms of supporting and promoting infant feeding. So what has actually impacted is now we are starting to adopt some of the things I learned from Cambodia, and when I shared with the team, they really saw that it is something that we can adopt up to the even national level, so that it can be taken as a serious national program, because in Cambodia, Baby-Friendly Community Initiative is a national program. The government of Kenya should take the issues of community infant feeding, the issues of taking the issues of infant feeding to the community seriously, where the issues of infant feeding, because it's the core, it's the child survival strategy which has the most impact. So they take them and integrate them in the ministry, because mostly they have been left with who is a well-wisher partner who comes and supports. But you see, like in Cambodia, it is the government that holds it at the end of the day. So that's what maybe we should do. Yeah, another recommendation maybe in terms of policymakers is the engagement of the high-level policymakers in terms of support for improving maternal infant feeding in Kenya. I realized we have not really engaged them. We have not even taken these studies we do to them. And when we had a meeting at Fairview, when we were disseminating the reports for the community engagement we did with the APHRC, one of the key recommendations was we don't talk, we stop talking to ourselves. We talk to other, because these things influence other ministries, like we were finding issues of sanitation, family planning, in the community, issues of food security, and it's not only in health, it falls under other departments, other ministries. So that is a multi-sectoral approach to addressing issues of MIYCN.